Every life begins with a story, a heartbeat, a breath, a cry that rewrites a family's world in an instant. Childbirth is more than a biological event, it is a moment of transformation, of power, of hope. Today we are going to explore a phenomenon that is quietly reshaping the landscape of motherhood. The rising wave of caesarean birth, what many now call the C-section epidemic. Once reserved for rare and urgent cases, C-sections have become far more frequent, often influenced by modern lifestyle, evolving healthcare practices, and deeply rooted perceptions. Behind each surgical birth lies a world of decisions, some made in urgency, others shaped by culture, comfort, or concern. But as the numbers rise, we must pause and ask ourselves, what are we gaining? And what might we be losing? In this presentation, we invite you all to look beyond the surface, beyond statistics, and beyond the operating room, to understand the emotional, physical, and social layers of this growing trend. It's not just about how we give birth, it's about how we honor motherhood, how we protect choice, voice, and care, and how we ensure that every birth, no matter the method, remains a moment of dignity, safety, and love. This is more than a presentation. It is a reflection, a conversation, and a call to awareness. Welcome to Stage Realities, the C-section epidemic. Let the story unfold.
Once a life-saving surgery, now a rising trend. Why are more and more babies being born through C-section, even when it's not medically needed? Let's explore the line between necessity and choice. A caesarean section or C-section is often the safest way to deliver a baby in certain medical situations. So, when is a C-section truly necessary? Medical reasons include prolonged or obstruct labor, fetal distress, placenta previa, BIDS presentation, multiple pregnancies, previous C-section with high risk. In these cases, a C-section can save both the mother and the baby. It's not a choice, it's a medical decision. But here's the twist. There's a growing number of elective C-sections, surgeries done without any medical necessity. So, why is this happening? Some women choose it to avoid labor pain, control the birth date, or due to previous bad experiences. Others feel pressure or fear, fed by misinformation or unrealistic expectations. Fear of pain, anxiety about complications, or even stories shared on social media. These all influence the decision. But is it really easier or safer when there's no medical reason? C-section is a major surgery, and like any surgery, it carries risk. Longer recovery time, higher chance of infection, breathing issues in newborns, complications in future pregnancies. Whether by choice or by need, every birth matters. But making that choice should be based on facts, not fear.
Healthcare system factors. Incentive and politics. In many private healthcare settings, C-section may be financially incentivized. Resource consumption in overcrowded or under-resourced hospital schedules, C-section may be seen as more manageable. Legal pressure, fear of malpractice, lawsuits can push providers towards C-section as a defensive practice. Professional practice, clinical judgment. Some providers may opt for C-section due to uncertainty or lack of support for vaginal birth. Training gaps. Limited training in managing complex vaginal deliveries can result in a lower threshold for surgical intervention. Patient counseling. Inadequate communication may leave patients unaware of the risks of unnecessary C-section. Conclusion. To address the C-section pandemic, a multi-level approach is needed promoting evidence-based practice, strengthening health systems, improving providers' education, and ensuring informed patients' choices. Thank you.
Health risks for the mother: infections, higher risks of window and urinary tract infections, longer recovery time. C-section involve major surgery leading to extended hospital stay, complication in future pregnancies, increased risks of placenta and complications during future deliveries. Health risks for the baby: breathing problems. Babies born in via C-section, especially elective ones before 39 weeks, have a higher risk of respiratory distress. Gut flora disturbance. C-section babies miss exposure to the mother vaginal microbiota, which can affect the development of immune system. Postpartum depression and anxiety. Studies suggest a higher incidence in mothers who undergo unplanned and unnecessary C-section.
Sociocultural and psychological influences. The societal perception of normal delivery versus C-section varies widely across cultures, regions, and even socioeconomic groups. Normal delivery, positive perceptions, natural and idealized, often seen as the default or biologically intended method of childbirth. C-section, positive perceptions, safe and controlled. In context where medical infrastructure is advanced, C-sections are viewed as safe and controlled alternatives, especially in high-risk pregnancies. Culture and regional variations. Western countries. There's a growing advocacy for vaginal births, with C-sections sometimes criticized for being too common. The influence of social media and family pressure can significantly intensify body image issues and fear of labor pain, especially during pregnancy and postpartum. Social media influences how it affects body image and labor anxiety. Unrealistic standards. Social media is filled with edited photos and highlight reels of pregnancy and postpartum, promoting unattainable beauty and fitness ideas.
Improving reproductive and child health requires clear practical steps. First, we must promote midwifery and support informed choice for mothers. Skilled midwives help ensure safe deliveries and educate women about their rights during pregnancy. Second, antenatal education and regular checkups are essential. These help detect problems early and lower the risk of complications. Third, we should follow government and WHO guidelines which recommended better healthcare access, trained professionals, and essential medicines. Finally, respectful maternity care is crucial. Every mother deserves dignity, empathy, and proper support, regardless of her background. In short, with strong policies, community awareness, and respectful care, we can ensure a safer, healthier future for both mothers and child. Thank you.
Childbirth is not just a procedure, it is a sacred passage, a moment where strength meets softness and fear meets love, a moment that every mother deserves to remember with dignity, with clarity, and without regret. C-sections have saved countless lives, and they will continue to do so. But when this surgery becomes common without cause, we must ask ourselves, are we really advancing, or are we quietly slipping into silence? The rise in unnecessary C-sections is not just a number, it's a signal that we need better education, kinder healthcare system, and deeper respect for maternal voices. Because a mother should never feel like a passenger in her own birth story. Let us imagine a future where decisions are informed, not imposed, where birth plans are honored, not rushed, where fear is replaced with trust and surgery is chosen only when truly needed, never out of pressure, never out of profit. Thank you for joining us in this journey. We hope this touched your heart, stirred your thoughts, and opened your eyes. Let us not just raise awareness,